Okay. So your lesson 1 class will deal with the vascular system and vascular disorders. Now, kapag sinabi mong vascular system, we're talking about here the blood vessels and its different components, which I will tackle in this lesson. So let's start. Now, overview of hemostasis class. So, hemostasis class came from the Greek words hem, meaning blood, and stasis, meaning halt. Basically, class, when you say hemostasis, this is the process of stopping blood flow. Stopping blood flow. It is defined as the mechanism which involves the interaction of vasoconstriction. Vasoconstriction meaning to 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 constrict the blood vessel so as to prevent blood flow. So pag nagkaroon ng vasoconstriction class, your blood vessels will constrict or tighten, preventing or decreasing blood flow. Then we also have your platelet adhesion and aggregation, as well as the coagulation enzyme activation, which we will tackle class in the coming meetings. Now, bleeding would be stopped or the excessive blood loss upon injury is prevented through the formation of a hemostatic plug, blood clot, and later on thrombus, which again later klase explain kayo para maintindihan nyo. Pag ang tao kasi nagkaroon ng sugat, the mechanism of the body is to stop the exit or to stop the blood flow from leaving the body. Because remember, if too much blood is removed from the body, it can cause death. So ang mechanism ng body natin is that to prevent that from happening. Now, take note of the important concept that would compose of your homeostasis or your hemostasis. We have your platelets, your blood vessels, and your coagulation factors. Now, itong mga coagulation factors nyo, we will be discussing this in the midterms. These are proteins class. If naalala niyo yung mga factor 1, factor 2, factor 3 yan, yan yung mga i-discuss natin sa midterms. These are important factors in hemostasis, along with platelets and the blood vessels, and even its activators and inhibitors, as well as yung fibrinolysis. Now, problems in hemostasis may lead to bleeding or thrombosis or excessive clotting. Then fibrinolysis leads to wound healing and repair. Now let's tackle first the cellular elements and plasma components of hemostasis. So meron siyang mga cellular elements. We have yung vascular intima, yung extravascular tissue factor bearing cells, and the platelets. Now yung vascular intima class, these are the cells of the blood vessels. Basically, yung composition ng blood vessel nyo. So, kung ito yung blood vessel nyo, class, meron ditong mga cells. Merong mga cells dito sa surface niya. That's your vascular intima. Then, meron ding mga layers dito sa likod ng blood vessel nyo, which we will also discuss in the coming, in the next slides. Then meron tayong extravascular tissue factor bearing cells. So ito yung mga cells na to that would release different tissue factors whenever there would be a damage or injury. Then ang isa sa mga pinaka-importanteng cellular elements sa mga thrombocytes nyo or platelets. Then we have your plasma components. Now these are the components class found in the liquid blood. So they would be composed of your coagulation factors, fibrinolytic proteins, and even inhibitors. Now let's take a look at the process and related functions of the hemostatic mechanism. So they would maintain blood in a fluid state while it remains circulating within the vascular system. So a major function of hemostasis class is to maintain blood in a fluid state. So imagine nyo if you have a clotted blood inside your blood vessels. Now this would lead to a cessation Kasi 'di ba pag may clot ka sa loob ng blood vessel mo, malamang iba-block niya yung pag-flow ng blood. Iba-block niya yung pag-flow ng blood leading to cessation of blood flow. Kapag nagkaroon ng cessation of blood flow, blood won't be able to enter the different organs, the tissues, and the cell. And when that happens, mawawala ang oxygen supply mo. And kapag nawalan ka ng oxygen supply, this would lead to death. So that's one important factor of uh, hemostasis. It is responsible, class, for maintaining blood in a fluid state. Now, contact among damaged blood vessel, blood platelet, and coagulation proteins to arrest bleeding at the site of injury or blood loss by formation of a hemostatic plug. So, ang ginagawa ng katawan natin, class, let's say ito yung blood vessel mo. Now, during an accident, nagkasugat ka, ang mangyayari is that yung blood vessel mo na nagkasugat, ito yung site of injury mo. Yung space na yan, yung site of injury na yan. What happens is that the hemostatic system, o yung mechanism ng hemostasis mo, is that it would first vasoconstrict. Iba-vasoconstrict niya yung blood vessel. Pababagalin niya yung blood flow. And after that, magpapadala siya dyan ng mga platelets, class. The platelets would adhere to one another, would adhere to the surface. Didikit siya dun sa surface, sa site of injury. And then after that, mag-aggregate sila. Magdidikit-dikit yung mga platelets, forming that so-called hemostatic plug. And by doing that, class, na prevent niya yung continuous bleeding. So ulitin ko ha, sa site of injury, whenever a person suffers from an injury, yung blood vessel nyo, yung mga platelets, yung first thing that would happen is that your blood vessels would constrict, papabagalin niya yung blood flow. After that, platelets would adhere sila dun sa site of injury. After adhering to the site of injury, class, they would aggregate with one another. Magkukumpol-kumpol, they would join together. Platelets will join together to form that hemostatic plug, which would serve as a barrier to prevent the exit of blood. Then development of a blood clot around the injury to limit this process to the vicinity of the damage. So another purpose nung blood clot nyo na yan, class, is to prevent the spread or the removal of blood. Then fibrinolytic removal of excess hemostatic material to ensure the eventual removal of the plug and reestablish vascular integrity when healing is complete. So meron ka na ditong hemostatic plug, class. Ngayon, ang purpose ng hemostatic plug mo, this is just a temporary barrier or a temporary block to prevent the blood flow. Once your tissues have been able to fully repair, naka-repair na yung mga tissues mo dun sa site of injury, dadating na ngayon yung fibrinolytic system. Now, this fibrinolytic system, class, will remove the hemostatic plug, allowing complete healing ng sugat nyo. Which later, para mas maintindihan nyo, i-explain ko later. But this is the summary, class, on how the hemostatic mechanism works. Now, let's take a look at the 5 basic sequence of the hemostatic process. So, ito yung hemostatic process na sinasabi ko kanina. Now, this is what happens when your body or your blood vessels suffer from injury. Now, there are 5 phases. Now, the first phase, yung step 1, is vasoconstriction. Now, in vasoconstriction, what happens is that the substance serotonin and thromboxane A2 promote vasoconstriction at the site of injury. Itong dalawa na to, class, si serotonin and thromboxane A2 will cause your blood vessel to constrict. They would constrict, they would prevent blood flow. Now, after vasoconstriction happens, babagal na yung blood flow nyo, the next step would involve platelet adhesion. Platelet adhesion. Now, in platelet adhesion, class, when your endothelial tissue is exposed or damaged, ulitin ko, kung ito yung blood vessel mo, meron ka ditong site of injury. Yung mga platelets mo, mag-a-adhere sila dito. Di ba merong layer di ba sabi ko kanina at the start, merong layer dito. Dito siya mag-a-adhere yung platelets nyo. And from there, they would adhere to the exposed endothelial connective tissue. Then the third step, after adhesion, mag-aggregate na sila, magkakaroon ng platelet aggregation. This is the interaction and adhesion of platelets to one another to form an initial platelet plug. And then after the platelet aggregation, pupunta na tayo sa mga substances ng coagulation. There would be the formation of a fibrin platelet plug formation. Coagulation factors would interact on the platelet surface to produce fibrin. Fibrin platelet plug then forms at the site of vessel injury. So, di ba nagkaroon na ng aggregation dito, class, para mas maintindihan nyo itong step 4. Once there is platelet aggregation, they have aggregated, they have joined together, what happens next is that the coagulation factors would enter. Now, these coagulation factors, may certain coagulation factors, will cause the production of fibrin. Itong fibrin na to, class, lagi nyo itong naririnig dati. This is like a net, a mesh. Para siyang net na parang sapot ng gagamba, wherein it would further tighten the aggregation of the platelets, preventing or forming a better platelet plug formation. And then after that, class, naka-join na yung fibrin doon. The next step would be fibrin stabilization. In fibrin stabilization, class, fibrin clot is stabilized by factor 13. So this time, super strong na, class, nung platelet plug na yan due to the addition of the fibrin and it being stabilized. Now, take note, class, that steps 1 to 3, yung 1 to 3, itong tatlong to, are involved in your primary hemostasis. So, itong vasoconstriction, platelet adhesion, aggregation are part of your primary hemostasis. While steps 4 to 5 are involved, take note, these are involved in secondary hemostasis. So, let's talk about the stages of hemostasis, class. So, yung primary and secondary na binabangkit ko. So, primary hemostasis, class, refers to the role of blood vessels and platelets in the initial response to a vascular injury or to the commonplace desquamation of dying or damaged endothelial cell. Platelets are activated and as a result, they adhere to the site of injury and to each other, plugging the injury. As mentioned earlier, steps 1, 2, and 3 of the hemostatic process are involved in the primary hemostasis. So para mas maintindihan niyo ang primary hemostasis, class, the two things involved here are the blood vessels and the platelets. They are the two things that are involved in the initial response whenever the body suffers from a blood vessel injury. So ulitin ko, class, primary hemostasis would involve two things, the blood vessels and the platelets. Silang dalawa, class, they are the two things that are involved in the initial response. Sila yung mga first respondents whenever there would be a blood vessel injury. They would help in preventing further damage or death to the blood vessel or the surrounding cells of the blood vessel. Then we have your secondary hemostasis. Now, this would describe the activation of a series of coagulation proteins in the plasma to form a fibrin clot. This insoluble fibrin forms a mesh that is incorporated into and around the platelet plug formed from the primary hemostasis. This mesh would serve to strengthen and stabilize the blood clot. Sa secondary hemostasis naman, class, ang involved naman dito, isa lang, or hindi naman siya isa technically, isang group of proteins known as your coagulation factors. Now, these coagulation factors will allow the production of fibrin, leading to the formation of a fibrin clot. So let me repeat, class. In secondary hemostasis, the one involved are your coagulation factors. Now these coagulation factors would join together to form fibrin. And with the addition of the fibrin, it would form fibrin clot. Sa primary hemostasis naman, class, ang end production nito is yung tinatawag nating platelet plug. So ito yung end step ng primary hemostasis. By reaching stage 3, pag naka-reach na ng stage 3 yung primary hemostasis mo, meron ka ng tinatawag na platelet plug. Kapag ang platelet plug, class, if the platelet plug is added with fibrin, it becomes a fibrin clot. So ulitin ko, in primary hemostasis, the end stage would lead to the formation of a platelet plug. Platelet plug with fibrin at the stage 5 will form the formation of a fibrin clot. So, now, take a look at the difference between primary and secondary hemostasis. So, ang difference nila, class, is based on 4 categories: the activation and the initiation process, components involved, product or clot form, and their response. So let's first tackle the activation and initiation process. Kung paano na-activate or paano nag-i-start. Sa primary hemostasis, class, it is activated. Nag-i-start siya. Activated by desquamation and small injuries to blood vessel. So to explain, class, kapag nagkaroon ng injury ang body natin, primary hemostasis, or nagka-injury yung blood vessel natin, primary hemostasis would activate. Then procoagulant substances are exposed or released by damaged or activated endothelial cell. While your secondary hemostasis naman, class, is activated by large injuries to blood vessels and surrounding tissues. So kung ang sugat mo lang, class, is on the fingers, enough na ang primary hemostasis to treat that, to be activated in that situation. But if very very small injury lang, but if you suffer from a stab wound, a gunshot, or a very big injury due to an accident, activate ang secondary hemostasis mo. Now, the activator tissue factor is exposed on one on-cell membrane. Then let's take a look at the components involved. Now, the components involved in primary hemostasis would be your vascular intima. Vascular intima, class, again, is your blood vessels and the platelets. While the secondary hemostasis, class, would involve the platelets and the coagulation system. Then the product or the clot form, in primary hemostasis, it would form platelet clumps, primary hemostatic plug, or yung platelet plug. While for secondary hemostasis, the end product or the product form would be your stable fibrin clot. In response naman, class, primary hemostasis is rapid, short-lived response. So mabilis siya, class, but due to it being rapid, being fast, it is also a short-lived response. While secondary hemostasis is delayed but has a long-term response. So those are the difference between primary and secondary hemostasis. Now let's take a look at the components of your primary hemostasis. The first one would be your blood vessels. Now, blood vessels are composed of 3. Yung arteries, yung veins, and yung capillaries. Now, the blood vessels are composed of 3 or are structured into 3 layers. The inner, the middle, and the outer. So, may 3 layer ang blood vessel nyo, class. The inner, the middle, and the outer layer. Now, the inner layer, class, is also known as your vascular intima. But vascular intima, class, can also be used, pakitandaan to, can also be used to represent the blood vessel. Meaning class, pag sinabi mong vascular intima, siya rin yung blood vessel nyo. So it could also be used to refer to the blood vessel. But here, kung sa structure pag-uusapan natin, it is known as the inner layer. Now, it provides the interface between circulating blood and the body tissues. Monolayer of metabolically active endothelial cells. Then we have the middle layer. This is your vascular media. It supports the endothelial cells. It is an internal elastic lamina composed of elastin and collagen. Then we have your outer layer, your vascular adventitia. This is a subendothelial connective tissue made up of collagen and fibroblasts in veins, collagen and fibroblasts and smooth muscle cells in arteries. So, ang outer layer nyo class, if it is in the veins, it is made up of collagen and fibroblasts. Pero kapag nasa arteries naman siya class, it is made up of collagen, fibroblasts, and the addition of smooth muscles. So, pakitandaan yan ha, your outer layer or vascular adventitia, in the veins, it is made up of collagen and fibroblasts. Pag arteries, meron siyang smooth muscle. Then let's go to the extravascular components of the primary hemostasis. Now, the extravascular components class are composed of endothelial cells and connective tissues. Now, itong mga endothelial cells na to, they have different functions. It's responsible for angiogenesis. Angiogenesis refers to the creation of new blood vessels. Then we have your coagulation, inflammation, immune response, synthesis of stromal components, vascular tone regulation, and special metabolic function. Now let's take a look at the anticoagulant properties of an intact vascular endothelium. Pag sinabi mong intact vascular endothelium class, there is no injury. There is no injury or damage to the blood vessel. Now, depending on the condition class, yung mga blood vessels nyo kasi they would have different properties or situation kapag intact sila or kapag damaged sila. Now, take a look at this. Meron siyang endothelial cell structure and substance and its anticoagulant property. So, let's first tackle the first one. Vascular endothelium is composed of rhomboid cells. Now, itong rhomboid cells na to, kapag ang vascular endothelium nyo is intact, buo, walang injury. The vascular endothelium, yung cells ng ng blood vessel mo, is made up of rhomboid cells. Now, because of these rhomboid cells, it presents a smooth, contiguous surface. So, ulitin ko class ha, if your blood vessel is intact, walang injury, walang damage, the vascular endothelium, yung surface ng blood vessel mo, is made up of rhomboid cells, presenting a smooth, contiguous surface. Then itong mga endothelial cells nyo on an intact vascular endothelium would secrete prostacyclin. Ano ba tong prostacyclin na to? Prostacyclin class is a eicosanoid platelet inhibitor. So, since wala namang damage, wala namang injury dyan class, piniprevent niya yung pag-form ng platelet dun sa area na yun. So, the endothelial cells would secrete prostacyclin, inhibiting platelets. Now, another substance produced by the endothelial cells, itong mga rhomboid cells na to, would also secrete nitric oxide. Nitric oxide class is a relaxing substance. 'Di ba sa yung tinatawag nilang laughing gas. Laughing gas is used as an anesthesia sa mga dentista class. Yan yung nitric oxide yan. Or nitrous, basta yung nitrous substance na yan. So, lalanghapin mo yan, you would feel relaxed. And in some case, ginagamit siya na sa mga party dati, if you heard in the news, binibenta nila yung nitric oxide na yan. Papalanghap nila dun sa mga party goers or sa club goers nila because it promotes a relaxing feeling. Now, kaya yan, the reason why it's being secreted class by the endothelial cells is because it produces a relaxing factor. And if there's a relaxing factor class sa blood vessel nyo, this would cause vasodilation. So bubuka or luluwag yung blood vessel nyo, causing blood to pass through more easily. Then endothelial cells would secrete the glycosaminoglycan heparan sulfate. Si heparan sulfate nyo class, di ba laging sinasabi dati sa Hemo 1 nyo, that heparin is our natural anticoagulant. But if we are going to be exact class, ang natural anticoagulant sa blood natin is known as your heparan sulfate. Si heparan sulfate or si heparin sulfate nyo is an anticoagulant that regulates thrombin generation. Thrombin generation class is like a clot. Pag nabuo yan si thrombin nyo, magkakaroon kayo ng clot sa blood vessel nyo. So by secreting heparan sulfate or heparan sulfate, nape-prevent yung thrombin generation. Then we have the secretion also of your tissue factor pathway inhibitor, si TFPI. This is a regulator of the extrinsic pathway of coagulation. Then endothelial cells will also express the protein C receptor on EPCR. EPCR stands for endothelial protein C receptor class. This is an integral component of the protein C control system. Then they would also express thrombomodulin. So magsisecrete din sila ng thrombomodulin class, which is known to control also yung protein C. And the last one is that it would secrete TPA or your tissue plasminogen activator, which activates fibrinolysis. So these are the different properties, the different substances whenever your blood vessels are in a normal state, walang injury, intact siya. Now, let's take a look naman kapag ano yung mga itsura ng blood vessel mo or ano yung mga substances of your blood vessels when it suffers a damaged blood vessel. So, smooth muscles in cells in arterioles and arteries. So, it would induce vasoconstriction class. Then, an exposed subendothelial collagen would bind von Willebrand factor. Si von Willebrand factor nyo class binds to and activates platelets. Then damaged or activated endothelial cells would secrete von Willebrand factor, which is important for platelet binding to the collagen at the site of injury, platelet adhesion as a first line of defense against bleeding. Then damaged or activated endothelial cells naman class would secrete adhesion molecules, yung mga P-selectin, ICAMs, PCAMs. They would promote platelet and leukocyte binding at the activations at site of injury. Then exposed smooth muscle cells and fibroblasts would cause tissue factor being exposed on cell membrane. Then endothelial cells and inflammation would be caused by the tissue factor, which is induced by inflammation. So ito yung nangyayari class kapag nagkakaroon ng damage ang blood vessel mo. So the smooth muscles in arteries and arterioles would induce vasoconstriction. And by having an exposed subendothelial collagen, magbabind dito yung mga von Willebrand factor, pati yung mga platelets niya. So those are the things that would happen in a damaged vascular intima. Now let's go to the different vascular disorders class. So ito na yung last topic ng lesson 1 nyo. So you now have an idea on primary hemostasis. Yung secondary hemostasis, we will discuss that in the midterms. So for now, let's go to the vascular disorders. Now, your vascular disorders class are categorized into 3. The hereditary vascular, the acquired vascular, and the purpuras of unknown origin. Now, kapag hereditary vascular disorders, under hereditary, we have your hereditary hemorrhagic telangiectasia. Hereditary hemorrhagic telangiectasia class is also known as your Rendu-Osler-Weber syndrome. Then we have your hemangioma thrombocytopenia syndrome, also known as your Kasabach-Merit syndrome, your Ehlers-Danlos syndrome, your pseudosantoma elasticum, your osteogenesis imperfecta, and your Marfan syndrome. Then after the hereditary o yung mga namamana or could be passed through in generation, meron naman tayong acquired vascular disorders. Now, the acquired vascular disorders class could be from organisms, microorganisms, or from the surrounding. So we have your allergic purpura, also known as your Henoch-Schönlein purpura, paraproteinemia and amyloidosis, senile purpura, cachectic purpura, corticosteroid purpura and Cushing's disease, drug-induced vascular purpura, infections, purpura fulminans, Waterhouse-Friderichsen syndrome, vitamin C deficiency, or your scurvy. And then we have also your purpura of unknown origin, which would include purpura simplex or easy bruising and psychogenic purpura. Now take note class of the causes of bleeding. So the causes of bleeding class would include platelet abnormality, defect in platelet endothelial cell interaction, and plasma protein defect. Easy bruising and spontaneous bleeding are the most common manifestation of patients suffering from vascular disorder. So kapag meron kang vascular problem class, the easiest sign, yung pinaka-easiest sign na meron kang vascular disorder is a person that is easily bruised, madaling masugat, and spontaneous bleeding, yung hindi agad-agad gumagaling na sugat class. Those are signs that there is a problem in your vascular system. Now, this could be related to a platelet abnormality, a problem in the activation of platelets, and plasma protein defect. So, itong mga to kasi discuss natin to sa lesson 2 when it comes to the platelet disorders. Now, take note of the terminologies used in bleeding disorders class. So, dito nyo maintindihan kung ano yung mga different types ng pasa. Kasi di ba pag sa Tagalog yung pasa natin is, well, it could be a purpura, it could be a chemosis, but take note of the different terms. Kapag purpura siya class, this is a recurrent bruising in multiple locations, usually has a size of 3 mm to 1 cm. Then kapag ecchymosis naman, this is known as bruising, usually greater than 1 cm. Then we have your hemoptysis, coughing of blood, hematoma, a solid swelling of clotted blood within the tissue. Yung hematoma na yan class, that would occur. One way for that to occur is when you accidentally puncture the blood vessel, na nasira mo yung blood vessel na due to improper blood extraction. Then hematuria, presence of blood in urine, epistaxis, recurrent uncontrolled nosebleed. So kapag nagkaroon ka ng nosebleed class, it's known as your epistaxis. But to be specific, it is a recurrent uncontrolled nosebleed. Usually longer than 10 minutes kang nagkakaroon ng nosebleed. Then we have your hemarthrosis, bleeding in joint spaces. This is a common feature of hemophilia patients. Then we have your hematemesis, which is the vomiting of blood. Melena, presence of blood in stool. Menorrhagia, excessive menstrual flow. Then we have your petechiae. Now, petechiae class are small red or purple spot caused by bleeding into the skin, usually less than 3 mm. So, yan yung tatlong klase ng pasa class. Yung petechiae, yung purpura, and yung ecchymosis. Yung ecchymosis class, this is the one that would happen if you suffer from an accident. Let's say, nabangga ka sa tiyan, nabangga ka sa abdomen mo, magkakaroon ka ng ecchymosis, a very big bruise. Yun yung mga malalaking pasa sa katawan natin. While your purpura are the smaller ones, yung kapag after ng blood extraction, nagkaroon ka ng pasa sa kamay or sa braso, yan yung purpura. While your petechiae naman class is a type of different siya. Hindi siya dark purple. But instead, your petechiae would usually involve the capillaries. In a petechiae class, your capillaries are larger, dilated sila. And because it is dilated or larger, mas madaming blood yung dumadaan, causing it to be more visible. And because of it being more visible, it would appear red or purple spots in the skin. Now, let's tackle the first group, yung hereditary vascular disorders nyo. Let's start with your hereditary hemorrhagic telangiectasia or the Rendu-Oster-Weber syndrome. Now, this is an autosomal dominant disorder. Autosomal dominant class meaning kahit one parent has the gene, magmamanifest yung sakit. Pakitandaan niya na kapag autosomal dominant, even if one parent has the gene, magmamanifest yung sakit. Now, telangiectasia, take note, would refer to dilated superficial blood vessels, creating small focal red lesions. Ang problem dito sa hereditary hemorrhagic telangiectasia nyo class is that it would produce a thin-walled blood vessel with discontinuous endothelium, inadequate smooth muscle, and inadequate or missing elastin. Blood vessels are fragile, prone to rupture. So madaling mag-collapse class yung mga blood vessel ng patients. Ang manifestation ng sakit na to, the face, the lips, the tongue, and under the tongue, conjunctiva, nasal mucosa, fingers, toes, and trunks are affected. Then often in organs, there would be bleeding class. Then nose bleeding, prolonged nose bleeding, may epistaxis din, or blanching lesions. Then from puberty throughout lifetime yung mga lesions na yung class, and it would worsen with age. Ang lab test nito, it would have a normal bleeding time and tourniquet test. And other related telangiectasia associated with liver disease and pregnancy, such as cherry red hemangioma, common in elder men and women, ataxia telangiectasia or the Lewy Bar syndrome, and chronic actinic telangiectasia. So itong HHT nyo class is associated also with other telangiectasia. Itong ataxia telangiectasia and chronic actinic telangiectasia. Then the second one is your hemangioma thrombocytopenia syndrome. Wait na class. Or also known as your Kasabach-Merit syndrome or the congenital hemangioma. Manifestation class, it would have vascular tumor. So meron kang mga tumor na mararamdaman sa blood vessels mo. Giant cavernous hemangioma, thrombocytopenia, and bleeding diathesis. There would be fibrin clot formation, platelet consumption, and red cell destruction secondary to vascular obstruction at the site of the tumor, associated with acute or chronic DIC, sequestration of platelets, and MAHA. Hemangiomas are visceral or subcutaneous and rarely both. External hemangiomas would become engorged with blood and resemble hematoma. Present at birth, mortality rate is 30%. So sa Kasabach-Merit syndrome na to class, meron kang mga malalaking tumor sa blood vessels mo. And because of these tumors class, they would be filled with blood vessels. Kaya nagmumukha ngayon silang mga hematoma. Parang malalaking pasa. 'Di ba ang tumor nyo, they are an abnormal tissue growth. What happens is that these tumors class would be filled with blood sa blood vessel nyo to ha. Pupunuin yan ngayon ng blood, and when that happens, it would now appear like a hematoma. Then we have your Ehlers-Danlos syndrome. This is an autosomal dominant recessive X-linked trait disorder. So pwede siyang autosomal dominant, pwede siyang recessive, pwede din siyang X-linked. Now, the defect in Ehlers-Danlos class is meron kang defective collagen production structure and cross-linking. So kapag may defective collagen production ka, you tend to have a loose skin and a weak connective tissue. Kaya pag nakakita ka ng picture class ng may Ehlers-Danlos syndrome, makikita mo dun yung balat nila is lawlaw, very loose. Tapos mahina yung mga connective tissue nila. Hindi nakadikit yung balat. Parang hindi nakadikit yung balat sa mismong skin glass. Sa mismong tissue niya. There would be inadequate connective tissue and some with platelet abnormalities. Laboratory findings would include a positive tourniquet test and a prolonged bleeding time. Manifestation would include hyperextensible skin, hypermobility, and laxity of joint, fragile tissue, bleeding, and subcutaneous hematoma, easy bruising to arterial rupture. Then we have your pseudosantoma elasticum. Pseudosantoma elasticum class is characterized by fragmentation and mineralization of elastic fiber. This is an autosomal recessive disorder. Then we have your osteogenesis imperfecta. This is an autosomal dominant defective collagen formation. This is related to a problem also class in the bone structure. Then we have your Marfan syndrome. This is an autosomal dominant disorder, decreased strength and elasticity of blood vessel. Now let's go to the second group, yung acquired vascular disorder. Under acquired vascular disorder, the first one is your allergic or anaphylactoid purpura. This is a non-thrombocytopenic purpura with allergic manifestation, skin rash, edema, malaise, headache, and fever. Usually caused by food, drugs, cold, insect bites, and vaccination. Now, ang pinaka-common example ng isang allergic or anaphylactoid purpura class is yung Henoch-Schönlein purpura. Si Henoch-Schönlein purpura nyo class is related to the antibody IgA. Whenever a person suffers from a disorder wherein IgA is the main antibody. 'Di ba ang mga IgA nyo, if you remember in your immunosero, is antibody found in your secretions. So kapag may mga problem ka doon class, there's a possibility that that Henoch-Schönlein purpura can develop. In Henoch-Schönlein purpura, you have vasculitis involving the skin, joints, kidneys, gastrointestinal tract, and the lungs, which is less common. This could also be an autoimmune vascular injury, autoimmunity to the vessel wall component. A patient will suffer from skin lesions class, palpable purpura on the feet, the elbows, the knees, the buttocks, the chest. Then it would also develop urticaria, pinkish red to hemorrhagic brownish red eruption, petechiae. Other manifestation class would include polyarthalgia, nephritis, abdominal pain, and renal disease. Usually affects children 3 to 7 years old class. Greater risk for males than females. Ang lab findings class sa Henoch-Schönlein would be normal platelet count, tourniquet test, bleeding time, and coagulation. But it would have an increased WBC and ESR, and in some cases, there would be anemia in severe types. Then we also have your drug-induced vascular purpura. So sa drug-induced vascular purpura class, these are usually caused by certain medical drugs. There will be drug-induced vasculitis occurring in the patient in the presence of functionally adequate platelets. So meron kang vasculitis dito class even if you have a normal platelet. This could be caused by the following drugs: aspirin, warfarin, barbiturates, antibiotics, sulfonamide, diuretics, digoxin, methyl-dopa, iodides, belladonna, atropine, quinine, procaine, penicillin, phenacetin, and chloral hydrate. Few petechiae to massive petechial eruptions. There would be a defect in the development of antibody to vessel wall, development of immune complexes, and a changes in vessel wall. So dito class sa drug-induced purpura, you would have a problem when it comes to your immune system. So you tend to have a weaker immune system because your antibodies are not able to be produced for the vessel wall. And also there's a defect in immune complexes. Then we have your paraproteinemia. In paraproteinemia, there is an increased concentration of plasma paraproteins, resulting to abnormalities in platelet aggregation, secretion, and procoagulant activity. Affects one-third of patients with IgA myeloma and Waldenstrom macroglobulinemia. 5% of patients with IgG myeloma, usually yung IgG3. Ang defects dito class, coating of platelet membrane with paraprotein. So ang nangyayari dito, amount, due to the increased amount of plasma proteins, they will tend to cover or attach to the platelets, causing the platelets to become dysfunctional. Hindi na siya gagana, hindi na siya magpa-function properly. And if it's not functioning properly, it would cause the following: inhibited platelet adhesion and activation, inhibited assembly of clotting factors on the platelet surface, and inhibited fibrin polymerization. So that's your paraproteinemia class. It causes a dysfunction of platelets. Then we have your amyloidosis. So amyloidosis is usually involving amyloid. Now, ano ba tong amyloid na to? Amyloid class is a fibrous protein consisting of rigid, linear, non-branching aggregated fibrils, approximately 7.5 to 10 nanometer wide and of indefinite length. Various proteins serve as subunits of the fibril, including monoclonal light chain, more than the kappa. Then defective deposition of abnormal quantities of amyloid tissue in vascular wall and surrounding tissue. There would also be purpura, hemorrhage, thrombosis. Lab findings class would include abnormal platelet function and decreased platelets. Kappa and lambda yan eh. Lambda more frequently than kappa. Then we have your senile purpura or cachectic purpura. More common in elderly men than women, and severity increases with age. So itong senile purpura nyo naman class or cachectic purpura, common to sa elderly people. As a person ages, pag ang tao tumatanda class, collagen is less produced. Umuunti ang collagen sa katawan natin. Now this is caused by the lack of collagen support for small blood vessels, loss of subcutaneous fat, and elastic fiber, causing saggy skin. Magsasag yung balat mo. Then there's also the presence of age spots. Ano ba itong mga age spots na to? This is characterized by brown stain, 1 to 10 millimeter flat dark blotches. Do not blanch with pressure and would resolve slowly. Extensor surface of forearms and back of hands, occasionally on face and neck. Di ba kapag nakakita kayo ng mga matatanda class, meron silang mga spots minsan. Yung kulay brown. Bilog siya class, bilog siya na kulay brown. So those are age spots. So nagre-resolve naman sila on their own. But in some individuals, in some old people, nandun talaga sila lagi or madami sila. This is due to senile purpura, due to the lack of collagen. Laboratory findings class would include increased capillary fragility. Then we have your scurvy. So scurvy is a vitamin C deficiency, decreased vitamin C, decreased collagen synthesis, weakening of capillary wall, and purpuric lesion. Then we have your corticosteroid purpura and Cushing's disease. Sa corticosteroid purpura and Cushing disease class, this is due to excess, sobra-sobrang glucocorticosteroid and therapeutic glucocorticosteroid. Excessive breakdown of collagen. So kung sobra-sobra yung mga cortisol mo class, yung glucocorticosteroids mo, it can cause the destruction of collagen, leading to a thin, fragile skin, vessel wall fragility, and bruising. Then there's also your continuous bleeding and bruising seen in women with emotional problems. Women experiencing this would experience this more often in due to hormonal levels during or after menstruation. So in women class, mas common ang cutaneous bleeding and bruising. Usually if they are suffering from emotional stress or a problem in their hormones. Then there's also your infection-related bleeding disorders. So, di ba iba-ibang these are caused by different microorganisms. So first, let's tackle your bacterial. Under bacterial, we have your meningococcemia, encysticemia, septicemia, typhoid, scarlet fever, diphtheria, tuberculosis, endocarditis, and leptospirosis. For viral naman class, we have your smallpox, influenza, and measles. Rickettsial would be seen in Rocky Mountain spotted fever and typhus. For protozoans, we have your malaria and toxoplasma. Now, in infection-related, meron tayong tinatawag na purpura fulminans. Now, purpura fulminans class is associated with sepsis or previous infection. So, if a person suffers from a terrible infection class, sobrang severe na infection na, wherein the blood becomes contaminated. So, di ba ang blood nyo dapat sterile yan? If it becomes contaminated with microorganisms, it would lead to purpura fulminans. This is also a cutaneous manifestation of your DIC. Then we have your Waterhouse-Friderichsen syndrome. So, naalala nyo to sa Neisseria nyo. In Waterhouse-Friderichsen syndrome nyo, this is an adrenal gland failure due to bleeding into the adrenal glands caused by severe bacterial infection caused by Neisseria meningitis. So that basically ends your lesson 1 class. Here are the references.